Hello everybody, this is Senator Melisa Franzen with the weekly update. We are wrapping up this legislative session in the next couple of weeks here. Lots of work in joint conference committees. The biggest item in the agenda this week was, of course, the State of the State by Governor Mark Dayton, where he addressed a joint legislative committee of legislators on Wednesday of this week, and we heard his view of Minnesota, how we've progressed and how we're moving in the right direction in terms of creating jobs and really investing in the priorities that we have neglected over the last few years, mainly early childhood education, education as a whole, and transportation. So that was pretty much the focus, and what I took from his comments was that's where we're going to be focusing in the current and in the future, in the next few years in legislative sessions. Very excited to hear about him and seeing that he's well and able to address our conference. A few other things that have happened this week is the APRN and CRNA bill, the nurses bill, where we were really one of the states that they're moving in the direction of allowing nurses to have more ability to practice to the full extent of their training and expertise. And this bill will eliminate the collaborative agreement with mainly doctors, and there's going to be some supervision in the part of the pain management, intervention pain management component of the bill. I heard from a lot of constituents, doctors and nurses, on the importance of this bill from the access to healthcare and also from the concerns that we did have on the pain management side. So I think we got to a good point with a compromise where we were able to have the entire Senate vote in favor of this bill, which is really a great outcome. So I thank you for all your input and expertise on this issue. As you all know, I serve on the Health and Human Services Finance Committee, so we had a pretty big debate on this issue when it was in committee, and then when we got to the floor, we finally got an agreement that I think all parties could move forward with. And lastly, last night, we're still working on the budget targets, and we're working towards figuring out how much we're going to be investing in the supplemental budget bill. Last night, I was able to testify in conference committee on the early childhood education bill, which is my bill to increase funding. Right now we are at $8 million target. My original request was a $20 million to eliminate caps on these scholarships that we passed last year, in addition to increasing the ability to have new scholarships as well for new kids. So we're still working on that. Testimony went really well, good feedback. The House has a position that they want to have the money going to the formula, but at the same time, we want to continue to invest in early childhood education as a whole, and the Senate position is one that really targets the ECFE programs, the school readiness programs, and also early childhood scholarships. So I'm hopeful that we are able to have that moving forward, and that this weekend, there's still going to be work this weekend with the budget closing up, is expected to close up by Sunday. So lots of work through late nights in the next few days, and all the way, I guess, until next week will we finally have a bonding proposal that we can start working on, that the public will be able to share. So I thank you for your time, for all the input that you've had on the bills that have come up on the floor. That's what we're focusing on, getting those bills to the floor and sending them over to the governor for passage and his signature. Thank you again for everything, and if you have questions, as always, you can always reach me at our office. Thank you, and go wild.